Here we are. Hello, everyone. My name is Annissa George. Thanks for tuning in. This discussion is thanks for tuning in, and my dog is happy that you're joining us too. This discussion is part of my Community Impact Series, where I join Boston residents to bring awareness about their work. I believe that the best way to find solutions to our most pressing issues is by making sure that everyone has a seat at the table. Today's discussion will focus on the role of nurses and school-based health services in our schools. I remember in my time teaching how important our school nurse was to me as an educator. Certainly when thinking about the best ways to support our students, my own classroom students during the time as well. And I certainly always think back to my years in school, how important the school nurse was to me. But I'm so glad that everyone's joined us today, and we've got some great folks here for this discussion. And throughout our conversation, we'll take questions and comments through Facebook Live. We'll do our best to answer as many as possible. So make sure that you add your questions into the chat box. I think it's down below. I'd like to welcome our guests, have them introduce themselves to us. I'll start with you, Maureen.
I am Maureen Scott. I'm a women's health nurse practitioner. And currently I work at the Common Square Health Center in the STI clinic. But the last 19 and a half to 20 years I spent in the school-based health centers run under Boston Public Health Commission. And the last 5 years of that time, I was the director of clinical nursing.
That's great. Thank you, Maureen, for joining us today. And then we've got Dr. Mary Kelly.
Hi, I'm Mary Kelly. I am a school nurse at the Josiah Quincy Elementary School for the last 5 years, and prior to that at the Carter School. I am a nurse practitioner until this year at Children's Hospital in the primary care setting and the complex care setting, and have been at Children's for 40 years. And I'm also a clinical nurse specialist and a clinical researcher.
I love it. Thanks for joining us, Mary. And then Georgie Marks, who's been on Facebook Live with us a few times. Hi, Georgie.
Hi, how are you?
How are you?
I'm Georgie Marks. I am a school nurse practitioner at Mission Hill and Margarita Munez Academy in Boston. So I take care of 3-year-olds through 12th grade. I've been with them for 14 years with Mission Hill. Prior to that, I taught at Simmons College. I also am a psychologist and a psych nurse practitioner. So I have a private practice in Dorchester where I see people for psychotherapy and psychopharmacology.
Oh, thank you, Georgie, for introducing yourself. Thank you, Mary and Maureen, for being with us as well. Georgie, I'm going to start with you. We've got lots of questions, and I've got some on my script, but the one I think I haven't asked you before in our conversations and just jumped out at me while you were introducing yourself is, how is it working with 3-year-olds all the way up to 12th graders? That's going to create a really interesting day.
It's very challenging, but at times it's rewarding because they all come into the same office. So I can have a 6-foot-tall 12th grader who will bend down and talk to a 3-year-old or a 4-year-old that's in there with a skinned knee. And it works out really well because I do a lot of teaching back and forth. So
I love it.
It's nice. It does challenge you medically, though. You know, when someone comes in with a headache who's first grade versus someone who's 8th grade, you know, it's like, okay, what are we going to do?
Yeah, no, that's great. And I appreciate that your work supporting our kids in the classroom and in our community. That's pretty fabulous. Maureen, I'd love to talk a little bit about your community health background. And I know that you've advocated for, you participated in a town hall I had not long ago around the role of school-based health centers. I'd love you to talk a little bit about your work in community health, and if you could explain what a school-based health center is.
Well, I've been in community health for most of my career. I was an OB/GYN nurse practitioner for a lot of it. I find real joy in giving back to the community. Right now, I'm working in an STI clinic, which services not only the community, but people outside of the community. And my work in the school-based health center was through Boston Public Health Commission, which at the time, I'm not sure if the clinics that are open now, but at the time serviced 6 schools in Boston. and a nurse practitioner. That the school-based health centers had the nurse practitioner, administrative assistant, as well as a behavioral health counselor. And the day-to-day routine is you see it was in the high school, so you see them for everything, anywhere from headaches to belly aches to feeling suicidal. And just the fact that you have a captive audience is what you really need. We worked collegial with the school nurses as well as their primary care. So I enjoy it, and I try to link up the place where I work now, Coedman Square Health Center. I try to link up the community health center as well with the school-based health centers and inform students that if they have a school-based health center in their school, to utilize it. They can also utilize school-based health centers for confidential visits, which is very important. Parents have to go to work every day, especially during this COVID time where we're just getting back into the workforce. It's so important that they don't miss work, where they have someone there at the school to take care of their child's needs. You can get prescriptions, physical exams, anything that they can do in the community health centers and in the hospital clinics, we can service them in the school-based health centers. So even though I'm not there now, I still have a close alliance with trying to get kids involved and trying to keep parents aware that we're out there.
That's the first time that's happened to me. My years coaching when I was teaching at Eastie High, we always utilize the school-based health center for those physicals, and it's a good opportunity. It sort of makes that piece easier for us as coaches and school building people, but it's also good for our kids that there's another option for them to access healthcare.
Definitely.
What's the key differences between a school-based health center and the regular school nurse?
Well, the school nurse, and any of you that worked in school nursing, please correct me, but the school nurse is pretty much in charge of the whole school community. She's the first line of defense. Students, if they're out of class because they're ill, the school nurse is the one to service them. If they have a school-based health center, and the school nurse and the school-based health center can work in alliance. Say the child comes down and is ill and just needs to rest, or just they're a patient of the school nurse and they have contact with the parent on a regular basis, the parent can come and pick them up or whatever. But if they're with the school-based health center, they may have something like what we were discussing before the show, like strep throat. So they can have a rapid strep test in the office. They can get treated. So the difference is that they can receive a diagnosis and a prescription. But it's what the school nurse does wonderful things, and you need the school nurse for the whole school community. And what we lack in the schools right now is a school. I don't know if there's a school nurse for every school. I know that there may be some that's part-time, but that's a big wish order.
Well, we've been working on making sure that we have a full-time nurse in all of our school buildings. So I see Georgie shaking her head, I want to hear off air from the school nurse, because that's really important. Mary, you are a school nurse. Can you tell us a little bit about a typical day pre-pandemic and maybe now, especially as kids are returning to the classroom?
Well, I work in an elementary school. I work at the Josiah Quincy School, which is the biggest elementary school in the city, and we have a wide variety of students. We have early childhood age at 3 years, all the way up to 5th grade. We also have a medically complex strand. So I can tell you about my day today. So in the morning, or yesterday, in the morning, we start at 9:30. At 9:40, we had a student come down actively having a seizure, and then was post-ictal for about a half hour afterwards. So one of the nurses took care of her. The other nurse, I was the other nurse at that time, we had 3 kids come in with injuries. 2 kids also came in with medications, so we have to take the medication, check and make sure we have like the appropriate doctor's orders. Then we have to enter it into SNAP. And then both of those students, I had to call up the mother because of their medical complexities. They had chromosomal anomalies, so we have to know everything about that with a specific disease. And so I had to make sure that this was all up to date. which takes reaching out to the physician, reaching out to the parent, talking to the teacher, informing them of that chromosomal anomaly, educating the teacher. Then comes at 2 o'clock, at like 11:30, I have to get ready for pool testing. And we do pool testing for about 110 kids within the school. That's going to the classrooms, picking the students up, doing the testing, and a positive test. So we were doing contact tracing and contacting families during the day to tell us what is, trying to find out who was the positive student. And then answering all the teachers' questions regarding, we should know first, as opposed to our perception, which is the students are positive. Therefore, we have to work with the students and their family first. And then we will communicate with the teachers once we have solid information. So it's a balancing act pretty continuously of medical emergency, chronic disease and case management, and then acute follow-up for keeping the school safe. Because the school to us is not just, oh, I have a sick student. It's also, I need to make sure that the teachers are confident in the skills that we have, confident in their abilities to take care of their students safely, as well as parents knowing that all of the children that are in the school are safe. So sometimes I think of it as a juggling act. I juggle my nurse practitioner knowledge and my 40 years of children's working only with children with complex medical needs, and knowing that with a teacher who doesn't know what an X-linked chromosomal anomaly is, and explaining that and how that affects the whole generation within the family. So it's a balancing act.
Yeah.
You really do. My colleague is a primary care nurse and primary care nurse manager. So she's able to bring in all of her, I don't have a strong management skill set, but she can run a clinic like nobody's business. And so we both balance each other out with our skill sets.
That's great. I appreciate you making note too of that teamwork approach, especially in a school with lots of kids and kids with complex needs. Georgie, tell us how have services changed over the years? I know we talked a little bit about this the last time, and certainly Mary and Maureen chime in, because nursing has changed over the years.
Yes, I think when I started back in the dark ages, we were primarily just doing first aid and nothing complex. And since then, we now have the diabetics coming in with the pumps that we have to manage. I know in my two schools, I have 166 kids with asthma. So you have to manage an asthma attack or prophylactic treatment. I always tell my nurse practitioner students that I precept that we are the emergency room and there is no physician backup. So that's pretty much what we get. And lately, I would say the last couple of years, huge amount of mental health needs have been surfacing in the schools, which we would have 1 or 2 kids in the past. Now I see 3 or 4 a day with mental health needs.
Yeah, I do worry so much about the return of kids to the classroom and to our school buildings as they return more and more. Their needs, especially around mental health, are going to be fairly significant. And I'm sure in your work, Maureen, you see that, especially in community-based health.
Oh, of course. I have a question for Georgie. Are you seeing more anxiety? Are you seeing more anxiety with being out for COVID and just the entering back into the school community?
Yep. While they were out, a group of us on student support, we each took a group of kids and we did mind, body, and soul groups because the anxiety rate was so high. We decided we were going to put them in a pool together, online, meet every week, talk about some techniques they could use, and basically check in with them so that now they're all transitioning back into school and we're going to run the group again in person. Because there's a lot of lack of resources too out there, which is a problem. And while I have you on there, the reason I made a face about a nurse in every school is there are 3 of us.
It's a dream.
There's 3 nurses that have 2 schools in one building. We do not, so that I have 2 schools. I don't have a nurse in each school. So just, that's why I go crazy when they go, oh, there's a nurse in every school. No, there's not.
All right, I'm making that note right here. Made it my notebook. How has telemedicine worked? I know that there is some telemedicine happening through school-based. You did some like check-in with kids virtually. That's my understanding.
Well, there's a difference between telemedicine, real telemedicine, and virtual check-ins with students. Real telemedicine is usually linked in through an established primary care provider. However, for example, at my school, we have student support hours and nursing hours set up virtually. And again, with anxiety, we've seen them as young as 5 years old with significant anxiety coming into and out of the school. Excuse me. Pardon me. However, we will, during Zoom, those times, we'd Zoom in with those kids.
Yeah, I would say that all my private practice is telemedicine. I see all my patients right now via internet, whether it's for prescribing meds or checking in and doing a little cognitive behavioral therapy with them. So that's what I have been doing since last March with the private patients.
That's fascinating to think about these 2 different roles that you play and how, can you tell us, Georgie, maybe a little bit about something that's working in your private practice that you wish that you could have work in a better way through your school-based practice?
Well, we don't have a school-based health clinic, which would be lovely to have.
Yeah.
So if you have kids with issue, especially we were talking mental health, if we call the best team, they're so booked, it's a 2-hour wait for them to come to your school. If you could have telehealth services established with a mental health provider so that in an emergency, you could dial in and have them assessed over the phone. Because as Mary will tell you, you have to step back over which role are you doing.
Exactly.
And I usually don't open my mouth unless it's a big red flag. And then I'll say to the social worker or whoever I'm talking to, you need to do this right now, type of thing. So and you know that it works in medicine because we see a lot of other people having their primary care done by telehealth, but we don't have the access to it in the school yet.
What are we going to add, Mary?
It's just the telehealth component to the stepping on roles. I mean, I've had, working in Boston Public Schools, I've been the primary care provider as a nurse. I've been the actual nurse practitioner and primary care provider for children's, and I can't prescribe. I have to say, come and see me tonight at children's, and then I can prescribe. But it's really looking at how one of the things that I would love to see is how we have so many advanced practice nurses as school nurses, not necessarily set up as a primary health care. There's a lot of medical, legal, but really using us to the best of our abilities.
And so why can they not perform just because it's not part of the license?
It's not part of the license. We do not have legal coverage. We don't have legal coverage. One of the things a lot of people think, oh yeah, I'll go to the school. The teachers will say, I go to the school nurse and they'll do my blood pressure. Well, that's illegal. We do it out of the goodness of who we are, but we're not supposed to take medical care unless they fall, have a heart attack, have a concussion. We're not supposed to take care. We're not supposed to do your blood pressure, hold your meds, your blood sugar. We're not supposed to do that, but we are put in positions where we have to.
No, I appreciate that. I didn't realize that.
As not doing our jobs. But the reality is it's illegal and we can be sued.
Right.
It's our licenses for doing it.
Right. Maureen, and that would be the benefit of having a community-based health center.
Oh, definitely. I'm
Absolutely.
I'm listening to you, Mary, and I know I've been there. It's hard. You're there with these people. This is your family every day.
Mhm.
So to tell them no, I mean, the community health centers, hospital clinics, when you take care of, I've worked in the school-based health centers, of course, so I can identify with taking care of students that aren't my patients, but they're my patients in school. So I can communicate with their primary care, but you run into the area where when you're doing physicals, the primary care would prefer that they come there, but you're in a stitch and they need it right away. So if community health centers and hospital clinics could really entertain sponsoring, putting school-based health centers out there and being the person that credentials those clinicians, or employs those clinicians, then the student would become part of the medical home, and you wouldn't have the issues. The student is also your patient as well as a patient of said
Right.
community health center or hospital clinic. And this is it seems really simple, and I know it has to do a lot with funding, responsibility, legality, but it's really something that we need to have a conversation about. There's a lot of people that may live down the street from a clinic or health center and never get there, but their child is in school every day, and that's where they're going to get their care. This is the reality.
Right. No, I think that's really fascinating and something that we definitely have to follow up on.
And I look at it from a health disparities perspective.
Exactly.
And looking at it, a school is a supportive, nurturant arena where people feel safe, so that they're not going to be quiet and not sharing with information. We have a different perspective on healthcare. I find, even having worked at Children's and BMC, it's we can take care of them. Well, the school nurse looks at it not as an us and them, but as an us.
Right.
And it's not that those disparities won't go away, but we will think of those in the first place.
Mm-hmm.
Those two, fourth and fifth down the line.
Right. And I think also what Maureen was saying is one of the aggravating things is to have someone come in. You're pretty sure it's a strep throat because we're not supposed to diagnose. And the kids go to the emergency room. And you want to just scream at them, because I'll say, call your primary care provider first. No, it's easier to go to the emergency room. No, it's not. Where if we had the school-based health center, we could walk them over there and say,
well, we think about how expensive healthcare is.
I know.
Oh, yeah.
One of the driving forces is not accessing primary care, ending up in emergency rooms.
I know.
This is great. I really, it's a very thoughtful conversation. So, where I think it's really important for any parents that are tuning in or students that are tuning in, what are some of the resources that our families maybe don't know about that exist?
We have been afforded during COVID many more resources as far as helping to alleviate food insecurities.
Yep.
We have many gift card series. The thing that's interesting to me is our school is in Chinatown, and many of the local community providers, we got a grant from Tufts. They graciously gave us a grant when we thought things would be opening up in the fall, where we could provide mental health as well as food supplementation of fresh fruits, vegetables within the Chinatown community, using the food and resources that they utilize on a daily basis. They may use different fruits, vegetables, meats, but these were all provided in there. So schools can do that. The other thing that we have is we're reaching out and they're affording more social work, and school psychologists are not just doing testing, intelligence testing now. The school psychologists are actually doing, if they have the time, they're doing a lot of support, not only with mental health, but with anxiety. We're very fortunate to have an excellent school psychologists who, because 65% of our students are English language learners, with the majority in various Chinese dialects, we have a school psychologist who can speak in Cantonese and Mandarin.
That's great.
And they don't have that a lot of times, even at Tufts, that services the Chinatown community. So we have a lot of language-specific providers, which might be different than some of the healthcare services.
Yeah, no, that's fantastic. Thanks for sharing that. Georgie or Maureen, I know we've lost Maureen for a second with her signal, but what are some of the resources that families may not know are available?
Well, just quickly, in both of my schools, we have full-time family coordinators, and the student support team meets once a week, and we talk about the kids that we think need food or need clothing or need access to care, and we try to make sure they get it within a day or two.
That's great. I'm taking notes here on the side.
And in this,
all right. So
school-based
this
health
is,
centers,
as we wind down to our last couple of minutes together, this is the question that I ask quite a bit. If there's something that you could change overnight, if you had this, the proverbial magic wand, what's, the one or two things that we could change or that we should be looking to change, whether it's around community-based healthcare or school nursing services? I'll start with you, Mary.
I wish we could have more immediate access to healthcare providers. Okay. A lot of parents think that there's this like magic cloud, the iCloud, where all this medical information is held and we have access to it, and we don't. I had a kid who had open heart surgery and a heart transplant, and the only reason I knew is because I looked at his chest and said, what happened? And called his mom. So if we had and then trying to get the healthcare provider to talk to me because of HIPAA laws, which are misinterpreted. I wish we could have better communication with the wonderful health care that we have in the city.
I would say that that's an important thing for the school nurse to know. That's important.
Oh, you would be surprised at what parents, and it's no statement about parents, because they believe that this information gets to us some magical way. And it is because medical providers will frequently say, oh, we'll take care of that. Oh, yeah, they'll know about that. And they have not established a mechanism to let us know.
Right. That's important. I appreciate that feedback. I haven't heard about that, but that does make very good sense. Georgie, thing we could change?
A nurse in every school.
Yeah, I like it.
I would love if we could change some of this pool testing stuff to maybe just test kids rapid testing who come in that we think have symptoms. I think it would be more efficient. And the access to care piece, when you're getting kids in, it would be nice to know all the medical stuff instead of being surprised when they walk in the door.
Well, and that's a huge administrative lift too for you. As you collect that information from families about students, sorting through it, uploading it, and all that sort of stuff. I know it's an administrative burden in some ways.
Right, but
we have students that come in on ventilators.
Yes.
And we do not have medical information on those kids. Right. Ventilators.
Yeah.
And one nurses, and we don't have medical information on them.
Yeah.
No
That's pretty amazing, and not in a good way.
Mm-hmm.
I appreciate that's I've received some education today for sure. And I would imagine if Maureen were answering this question, she would say a school-based health center, a community-based or a school-based health center in our schools. So
yes.
I'm gonna take that one from you. If you hop back on, I'll let you say it yourself. But I'm so I'm grateful for the conversation today, and grateful for the information, I think, not just from me, but those that are watching and listening from home, because it's very informative. I'm so grateful for the work that you all do, the three of you do, to help our city's residents, to work with our kids, especially our kids that are most at need. And, as we wrap up, everyone at home, conversations like these inform my work and are critical to keeping us moving forward and making progress. If you have organizations, guests, or topics you'd recommend for us to discuss and to invite onto one of these community impact series or a listen and learn series, please email me at Annissa@AnnissaForBoston.com. Georgie, Mary, Maureen, I'm so happy to have you with me tonight. Have a great evening.
Oh, thank you. Bye-bye.
Thank you.